So dentists ask us all the time, how do we increase and improve our hygienist's ability to co-diagnose and help tee up restorative treatment for the doctors? So as you probably know, hygienists are taught that they are not allowed to diagnose, and that's generally true. The dentist makes the final diagnosis. However, hygienists have the experience and the knowledge and are completely capable of educating the patients of what they are observing. So here are 3 simple leadership steps to take to really increase hygiene co-diagnosis. First and foremost is permission. No matter how long you've been working with your hygienist, it is a great idea to start with giving them permission to share with the patients what they're seeing and what the doctor is probably going to recommend, right? So look at this house. This is a great example and a great analogy of this experience. Some dentists would like for the clinical team, this applies to assistants too, to really educate the patient on the problem, right? Take an intraoral photo, show them where the tooth is cracked, show them where the old filling is leaking, but then the dentist provides the solution. So in this example, that would be maybe taking the patient about halfway from the start of this path to the house, right? And the front door is really the doctor's operatory. So eventually you want the patient to make it all the way up to that front door and for the dentist to open that and the patient to enter and have that treatment completed. So recently I was speaking at a CE conference and one of our Inspired Hygiene clients actually happened to be sitting in the room. And I asked this question, I said, dentist, share right now with your hygienist how far down this diagnostic path would you like to give them permission to take your patients? Do you want them to take them halfway down the path and create the problem, but leave it to the dentist to really share the solution? Or would you like for them to take that patient all the way to the front door? And this doctor said, you know what, I would like for that patient to be ringing the doorbell, which means that he would like for his clinical team to be knowledgeable and confident enough to share the problems and to also share with the patient the possible solution, right? What are the treatment options? And obviously then all he needs to do is come in and really make the final call, and then the patient will be ready to say yes to treatment. So first step is permission. You've got to explicitly give your team permission to take the patient down the diagnostic path as far as possible. Second is knowledge. The thing that's going to build confidence with your clinical team in doing this is you sharing your treatment philosophy with them. They've got to be in lockstep with how you treatment plan cases. Now, obviously you're not going to start with a complex case. We recommend doing case review meetings where you bring in 1 or 2 patient charts and you really look at what was their medical history, look at the x-rays, look at the intraoral photos, and without you sharing the treatment plan, have your team do a mock-up treatment plan and see how close or how far they are away from yours. All right, now start with something simple. Don't start with a super complex case, right? You want them to succeed. But this is an example of how you're giving them that knowledge so they can develop the confidence to really see these patients and see these situations as you would see them and know what treatment options you would recommend. The third leadership step is accountability. So for example, if you have made the agreement with your hygiene team that they're going to take 1 intraoral photo on every patient to really assist in this co-diagnosis, you've got to hold them accountable, right? You both agreed to this, and also assuming that all the equipment is in place. So they have working, operating intraoral cameras in every hygiene op. Here's what happens, right? The hygienist asks for a doctor exam. You come in, and there's no photo. So what you can say is, you know what, Rachel, I would love to do the hygiene exam. Just as soon as you take that photo, I'll be right back. Okay, it doesn't have to happen too many times to where the hygienist knows, hey, I really need to have this photo ready. Ask me how I know, right? I'm a hygienist too. So permission, knowledge, and accountability, these are the 3 leadership skills. The dentist, this is your responsibility to really roll this out with your clinical team to improve restorative co-diagnosis.